Dementia is not a simple disease. Losing memories can be one of the most frightening experiences for us. As part of the effort to understand the profound impact of dementia on our lives and society, Silver Queens have prepared an 8-part special on dementia. We will introduce what dementia is, its symptoms and prevention, methods, and ways for families and society to cope with dementia together. Dementia is often referred to as social death. The reason dementia is perceived as social death is primarily due to the loss of social participation and identity. Social death occurs when an individual's social relationships and identity are dismantled, which can happen when conditions like dementia exclude individuals from social participation. Dementia damages cognitive functions and memory, making it difficult for individuals to engage in social activities and relationships, ultimately amplifying feelings of isolation. Over time, dementia patients gradually lose independence in daily life and require care, which can give them the feeling that their existence is not socially recognized. This is similar to the characteristics of social death, where dementia patients gradually lose their social identity and are excluded from relationships. However, the possibility of developing dementia exists for anyone, and dementia patients are reported worldwide, with approximately 10 million cases annually. According to WHO statistics, and as of January 2023, 55 million people are receiving dementia-related medical services. Dementia patients exist everywhere in the world, and their dignity and rights must be respected, as they could be part of our own families. Hello, we are Silver Queens. Today, we will explore the differences in perception of dementia around the world, particularly focusing on Japan's social responses to dementia. As a society that has entered the super-aging phase early, the perception of dementia varies significantly across cultures and social backgrounds. Different countries view dementia as a natural aging process, a disease, or even a test by divine beings. Today, we will examine the cultural and social differences in how dementia is perceived. First, let's look at it from a cultural perspective. In East Asian Confucian cultures like Korea and China, there is a tendency to view dementia as a family responsibility. This is related to cultural values emphasizing family harmony and filial piety. Dementia is sometimes seen as fate or a result of past mistakes. For example, in China, caring for dementia patients is related to family honor and maintaining social status. In Hindu cultures centered around India, dementia is often viewed as a natural part of aging or as a second childhood. This is related to philosophical views of starting a new life after leaving this world. However, in India, awareness of dementia is generally lacking, and dementia patients are often socially marginalized or ignored. For instance, it is very difficult for dementia patients in India to receive a diagnosis and proper treatment. In Latin American cultures, dementia is sometimes seen as a divine punishment or magic, which can lead to negative perceptions. These perceptions can cause significant difficulties for dementia patients and their families. In European and North American cultures, dementia is primarily viewed as a medical condition, with relatively advanced awareness and treatment. However, there is still a stigma surrounding dementia, and efforts are needed to overcome it. We will also examine social perspectives and national responses to dementia. In many developing countries, families bear the primary responsibility for caring for dementia patients, which can increase economic and mental burdens on families. In India, caring for dementia patients is largely seen as a family responsibility, significantly impacting family life. Access to dementia-related medical services varies greatly by country. In some countries, dementia diagnosis and treatment are easily accessible, while in others, these services are lacking, leading to delays in diagnosis and treatment. In Korea, since September 2017, a national dementia responsibility system has been implemented to provide various supports for dementia patients. For example, anyone over 60 can receive free dementia screening tests at local dementia centers by simply presenting their ID. These efforts greatly help dementia patients and their families, and contribute to improving awareness of dementia. In China, there has been an increase in efforts for dementia diagnosis and treatment in recent years, contributing to better care for dementia patients. Some countries are working to create dementia-friendly societies, aiming to help dementia patients maintain social participation and live independently. The World Health Organization established a global action plan for public health responses to dementia in 2017, allowing countries to design national policies by 2025. Japan, as a super-aged society with 28.2% of its population over 65 and expecting 1 in 4 citizens to have dementia by 2045, is diligently working to better understand and address the needs of elderly dementia. Japan has been at the forefront of dementia treatment and awareness since introducing its national plan in 2015. In Japan, facilities providing dementia-friendly spaces and human-centered care for dementia patients are increasing. These facilities help dementia patients live independently and improve their quality of life. For example, the Jinmokase Funabashi nursing home supports dementia patients in maintaining daily life routines, contributing to their happiness and satisfaction. Another example is the Iki Higashi Toyonaka nursing home, which emphasizes personal connections between staff and residents. It adopts a holistic and human-centered approach, targeting physical, mental, and emotional needs. Staff not only provide necessary medical services, but also guide group activities like baking cookies based on residents' interests, fostering friendships among residents. The entrance features a candy store, and the facility includes toys and comics to welcome children from the surrounding area, integrating the nursing home and its residents into the local community. This integration extends to visitors, helping combat the social isolation experienced by dementia patients. This nursing home extends human-centered care to visitors, allowing them to see its benefits firsthand. Visitors receive simple lessons on respect and etiquette before being paired with residents to apply human-centered care practices. By participating in activities like origami, piano, and coloring, we show enthusiasm for engaging in their hobbies and learning about their personal lives. This builds trust, and despite language barriers, they feel comfortable with us helping them during tea time and walking around the house. Iki Higashi Toyonaka Nursing Home demonstrates practical techniques for applying human-centered treatment by focusing on building meaningful interpersonal relationships and mutual trust. Considering personality, preferences, and actual experiences in human-centered treatment is becoming increasingly valued as an effective way to maintain the dignity and sense of achievement of elderly dementia patients. The core of each treatment facility is not the visible physical symptoms, but the perception of the dementia patient as an individual. These human-centered treatment strategies can be applied globally across various cultures, socioeconomic backgrounds, and political environments. To address the needs of elderly dementia patients for acceptance, inclusion, and independence, specialized equipment or extensive medical training is not necessary. Instead, it is crucial to recognize dementia patients as individuals entitled to treatment that acknowledges their human needs for social connection and respect. That's all from Silver Queens for now.